It's a real pleasure to be here at the SEIU headquarters in Richmond Hill with Charlene Stewart, the president of the SEIU. It was an opportunity for me to sit down with extraordinary personal support workers and hear their stories. We all know how important personal support workers are to our healthcare system, to our care system. They were there for the most vulnerable during the pandemic. They continue to be there through extremely difficult times. The challenges they're facing is stretching them and burning them out, and we need to do a better job of stepping up as governments to make sure that we're giving them the support and respect that they need. That's why we've put forward $1.7 billion towards raising their minimum rates to $25 an hour, which is pretty much the bare minimum that they're going to be able to continue doing their job in. But we also need to make sure we're improving their working conditions. That's why we put out a study last month on minimal conditions in long-care homes across the country, because we know that working conditions dictate conditions of care. And how we support the personal support workers who do this incredible work right across the country really matters. We also need to do better around retention and looking for retirement benefits for them as well. These are things that the federal government will be there for, but we will also be working on with the provinces. And I'd actually take a moment to encourage all politicians at all different orders of government to take time to sit down with personal support workers like I got to today, to hear the stories, to hear directly how much they care about the people they serve. And about the grandparents of all of us that they take care of in situations that are extremely precarious and not there for them. The past weeks, we've been talking a lot about healthcare because 2 weeks ago we put forward a plan for $198 billion of investment over the next 10 years in healthcare systems across this country, with a focus on making sure that we deliver altogether real results for Canadians in a public, universal healthcare system. These are things that really matter to Canadians. Canadians take pride in our healthcare systems, but they also know they're not hitting the level that Canadians should and could expect from their systems. That's why the 4 areas that we're focused on investments with the provinces and improvements of the provinces are access to primary care doctors. Canadians need access to primary care doctors to make sure they're having the right entry into our healthcare system, getting the primary support they need. That'll make huge changes and improvements in our system and the results for Canadians. We also need to do a better job of supporting and retaining and properly being there for the people who work in our healthcare systems. We need to do better around licensing and credential recognition. We need to do better around working conditions and support for people who are taking care of all of us at all levels within our healthcare systems. We need to do more, thirdly, on mental health, because we know that mental health is health. A number of years ago, we invested $5 billion over 10 years to the provinces on healthcare. We've continued to step up with investments around healthcare, but we know as well that healthcare must be woven through the rest of the healthcare system. Mental health must be woven through the rest of the healthcare system because it affects everything from the workers to the patients to everyone who is supporting people going through difficult procedures. Finally, we're there for better data and better information collection. Canadians need to be able to have confidence that their medical files are complete and accessible by the specialists or emergency room doctors they see. And we need to make sure that we're seeing clearly the results right across the country that we're investing in and getting better results from our healthcare system. So there's a lot to do, but there's a lot we're going to continue to do together. And I just really want to thank the leadership at SEIU, but also those personal support workers and all healthcare workers across the country for continuing to step up to be there for Canadians, and we will do everything we can to be there for you like you are there for our most vulnerable.